Flu season is in full swing here in western New York. Chautauqua County is now seeing a big spike in flu cases. Just like Erie County, the number of positive tests has doubled in just the past week. News 4's Alicia Rodriguez explains one of the reasons for this spike. Alicia?
And Alina, it's not just people who didn't get the flu shot that are getting sick. Many who have been diagnosed were immunized. This year, the vaccine isn't working for many people. Western New York is in the middle of a flu outbreak. In both Chautauqua and Erie County, there has been a spike in cases.
We really haven't seen this high numbers this early in the season for several years.
Erie County's Commissioner of Health, Dr. Gail Bernstein, says there's a big reason why this year's flu vaccine doesn't completely match the strain of influenza A that is circulating. Doctors are finding that even people who got the shot are getting the flu.
We do have what we call partial immunity, but it's not stopping the spread of the disease.
But Dr. Colin McMahon, the chief medical officer at Buffalo General, says it's still a good idea to get the shot.
We usually get 2 outbreaks, one in midwinter right about now, and we'll probably see another outbreak come March. So that's why even though the flu vaccine may not be 100% effective, it's still very much worthwhile to get it. Haven't got it yet? Please, you have a second outbreak coming, it's worthwhile to get.
Despite the increase in flu cases, the 2 drugs used to treat it are still in good supply.
In areas of the country, there have been reports of sporadic shortages. However, we've learned from the manufacturer that they have good supplies. They're cranking it out. And so, pharmacies should be able to get a hold of it.
But just like the vaccine, Tamiflu isn't a magic fix. It works best when taken within 48 hours of the first symptoms, and it only works in combating influenza A.
Oftentimes people will talk about, oh, I got the flu, that 48-hour bug. That's not what influenza A is. Influenza A is knocked down in bed 5 to 7, maybe 10 days, praying for God to take your life. It's a miserable, miserable thing to have.
And the doctors we spoke with say the 2 best things you could do to protect yourself are to get that flu shot and wash your hands as much as possible. Reporting live, Alicia Rodriguez, News 4 10.